Yossi Media and the American Heart Association presents Check In and Check Up for Your Health. During the month of May, we focus on stroke awareness. Stroke, defined as a brain attack, most often occurs when blood that brings oxygen to your brain stops flowing and brain cells die. When it comes to this disease, Black Americans suffer disproportionately with higher death rates than any other racial group. In addition, Black stroke survivors are significantly less likely to be treated for many complications, including fatigue and depression, compared with white stroke survivors. Strokes can happen to anyone, at any age. Having a stroke puts you at higher risk for a second one. That's why it's important to learn the warning signs and know your risk factors, which include high blood pressure, obesity, diabetes, stress, and more. Not all the reasons are clear why Black people have an increased risk of stroke, but there are things you can do to reduce your risk. Today, joining Sybil in our discussion about stroke awareness are vascular neurologist Dr. William B.J. Hicks, stroke survivor Dawn Turnage, and comedian Roy Wood Jr. This special edition of Check In and Check Up is brought to you by the Elevance Health Foundation. With the support of the Elevance Health Foundation, we work to address health inequities and strengthen our communities across the country. Get ready to take notes, learn more about stroke and how to prevent it. And now, here's Sybil.
Hello, and welcome to Check In and Check Up for Our Health. I'm Sybil Wilkes, and we are going to have a discussion today in partnership with the American Heart Association about strokes and hypertension. May is Hypertension Awareness Month. Hypertension, high blood pressure, those are one and the same. And we're going to give you some facts and some information about this. About 55% of Black adults have high blood pressure. Or as they used to say in my granddaddy's day, they got the pressure. You got the pressure. Black people also have disproportionately high rates of more severe high blood pressure, or HBP, and it develops earlier in life. There are some historic and some systemic factors that play a major role in these statistics that I just gave you. Among them, the report is that there are adverse social determinants of health, the conditions in which a person is born and which that person lives. The determinants include lack of access to proper health care, lack of access to healthy foods. Many of us live in that food desert, and other societal issues. Certain medications also may be less effective in controlling high blood pressure in some Black people, and they may require a cocktail, if you will, of two or more drugs in order to properly get the blood pressure goal that the doctor and the patient have set together. Stroke is the fifth leading cause of death and a leading cause of serious long-term disability in the United States, despite stroke being largely preventable, treatable, and beatable. Did you know that approximately each year, 800,000 people in this country suffer a stroke? Today's guest will lend information and life experience. As we talk with Dr. William B.J. Hicks, our old friend is back with us today. He is a neurologist specializing in vascular neurology, and stroke survivor Dawn Turnage. I'm so excited today to welcome in our co-host for the day, and it is none other than the award-winning comedian Roy Wood Jr. Hello, Roy. How you doing?
How are you doing? How you been? How you been? You look nice with the plant back there. You give me something to aspire to in the background. I'm still all plain back here.
I like the sports theme though. I like what you're working with there.
That's a football sitting on the box. But thank you for the compliment. We trying to do it up. We're gonna get better.
Okay. Well, I'll send you a plant to kind of brighten up the place. How's that?
Okay.
All
I'll
right.
take that.
Roy, as I like to say, is Black royalty. His mother, Mrs. Joyce Wood, is an HBCU giant and as a college administrator at Miles College. And his father, and I should say, Roy is also HBCU royalty as an alum. He is a Rattler. He is an alum of Florida A&M. And
That's
Roy's
right.
dad, Mr. Roy Wood Sr., was a radio broadcasting and journalism pioneer who covered the civil rights movement, the racism encountered by African American soldiers in the Vietnam War, as well as other important stories that affected our lives and lives of others around the world, including the Soweto uprising. Roy Jr. has also blazed a trail in his own right as a comedian, a writer, an actor, a radio show host, and as recently as last year, he was the host of the White House Correspondents' Dinner. and a longtime member of The Daily Show. And just this is parenthetically, Roy, I might add, should have been the host of the show when
Oh,
Trevor
you too
Noah
kind.
retired. Welcome, my friend. Thank you so much for joining us.
Thank you for having me. A pleasure to be a part of this wonderful, wonderful, and meaningful situation.
Yes, sir.
You
Yes,
know,
sir. So Roy, how are you? How you doing? What's going on in your world?
I ain't got no complaints. I've been raising this child. You talk about health. It's what I one thing I do realize now that I'm a little older. I'm raising an 8-year-old.
Ooh,
Is
he's eight.
one of Yeah, he 8 now. That boy grown. He be lying and everything. They smart.
Yeah.
These kids are smart, know how to play mama against the daddy, the whole nine. So the idea of passing down good eating habits
Hmm.
and exercise and just an active lifestyle
Right.
is something that I'm trying to pass down to my son. That's something that does not necessarily come naturally
Right.
for me. But for him, it's something that I definitely, work harder at. So, walk a little bit, oatmeal a little bit.
Eh,
I do what I can, but I'd say, all in all, I'm pretty good.
well, let me ask you this. Since we're talking about this particular subject today, do you have any experience with hypertension, either with yourself or a friend or a family member?
On my mom's side, there's a little bit of it, and going to the whole diet thing. That's also part of why I want to make sure that my son is just aware of, where the smart choices are. I don't
Right.
think it's completely realistic to eat healthy 24/7 like you training for the Olympics,
Right.
but you have to know what the good and what the bad are, and like really, drilling down on that. And
Yeah.
but no, I for my health, it's been a little bit of, pre-diabetic,
Hmm.
here and there, and making sure that that stays medicated and I eat properly to keep that in check. Um, and a little bit of sleep apnea, which ironically can lead to high blood pressure
Right.
if you don't
Right.
handle that properly.
That's
So,
right.
I think when we talk about health, especially in the Black community, we're talking about problems that usually compound one on top of the other, on top of the other, because diabetes messes with your circulation, which then messes with the
Hmm.
blood pressure as well. And if you got
That's
high
right.
blood pressure and it can
And
be
it
a
just kind
lot of
of
stuff.
builds on one on the other, right?
Yeah, but also you look at it from a space where, and the doctor can correct me on this, where the solution to one issue usually plays positively into benefiting you in other areas, of your life as
Right.
well.
So let's go to the doctor. He is a very busy man and is taking out time to join us today. And he is our expert. And he's joining us again. It's great to see you again, Dr. Hicks. It's Dr. William B.J. Hicks, vascular neurology. Dr. Hicks specializes in the conditions of cerebral vascular system, including ischemic and hemorrhagic strokes. His main areas of interest include a rapid access to acute stroke rescue therapy and clinical trials. And he's got a new gig since the last time he was here with us. He's been named the Vice President of Neurosciences at Ohio Health in Columbus, the former president of the Columbus American Heart Association, and now president of their Midwest Board of Directors. Welcome back, Dr. Hicks. It's great to see you.
It's my pleasure. I thoroughly enjoyed my time last year, and this month is near and dear to my heart and brain, literally and figuratively. But boy, I was just hearing, one of my favorite comedians start doctoring, and I said, what am I here for? I ever thought I could, you know. Maybe we could talk HBCUs, like behind me here, but
FAMU versus Morehouse
Well,
versus
we
Howard.
can't,
Howard Med,
we
what
can't,
you gonna do?
fam Ewans, we got to be quiet for a minute. We got to,
Yeah,
somebody,
yeah,
somebody tried to run a scam on us. Y'all trying to clown
yeah,
us. So
yeah,
I
yeah.
ain't got that much pride right now. I'm going to just hush.
Hey,
You know,
look,
Morehouse had the president speaking,
yeah,
talking about forgiving student loans. And,
it's been a bad couple of weeks, for
yeah, we got scammed by brothers in a JC Penney's jacket. That's what you need to talk about next month. Is how not to get scammed by a brother in a jacket that don't fit. I'm sorry, doctor. Go back.
We all got issues. We all have that. No worries.
This is
Little,
what I expect when I follow Roy Wood on X and Twitter. Like
that's
this is
right.
what I get. This level of comedy. So
Yeah.
it's great to hear it live.
And in person, right? Yeah,
Yeah.
he's a very bright and funny man. So let's get right to it, Doctor. Can you explain to people who may not understand and are just today, they may know the word, but what is a stroke?
So stroke is a sudden thing. That's something that we really have to understand. It's a sudden attack that usually occurs when blood that's giving oxygen and nutrients into your brain suddenly stops. And when it suddenly stops, brain cells suddenly die. And when that happens in a certain part of the brain, that part of the brain that gives direction to your body or to your mind to do certain actions all of a sudden stop.
Hmm.
So that's why the symptoms are so sudden, because it's a sudden blockage of blood flow, or a blood vessel can burst if it's a bleeding type of stroke. And both of these can lead lasting serious issues that need urgent emergent treatment.
Wow. And there are types of strokes, right?
Yeah. So the most common is the non-bleeding or the ischemic stroke. That's where the blood vessels in and around our brain, there's a large swath of them. It's like a big tree with branches. And when a blood vessel gets blocked with either a blood clot that came from the heart or came from another bigger blood vessel somewhere, or some people have clotting disorders where your blood can get thick for just random reasons.
Mm-hmm.
And it can throw a blood clot high into the brain and cause that to suddenly block. Other types of these ischemic or non-bleeding strokes is when they just over time narrow and harden. You hear people say hardening of the arteries.
Mm-hmm.
That doesn't just happen in the heart. That can happen in the brain. It can happen in the kidney. It can happen all over your body. And so when those blood vessels start to harden, the flow doesn't get through as quickly and as expeditiously as we're used to, and it could suddenly stop the blood flow that way. So that's the ischemic or the non-bleeding stroke.
Mm-hmm.
That's about 85% of all strokes. The other 15 are when a blood vessel bursts. We hear the adage pressure bust pipes. Well,
Mm-hmm.
that really happens. That happens in the brain, where over time, if your blood pressure is high for a long period of time, it's just too much pressure on that pipe, on that particular blood vessel, and it can cause it to burst. That's the most common cause of bleeding strokes. Those are the toughest ones to treat. We don't have the treatment options for the bursting blood vessel hemorrhagic strokes or the bleeding strokes, like we do the options for treatment in the ischemic stroke. But we're getting better, and we're working on treatment options for the bleeding kind as well as the non-bleeding.
I don't know about you, Roy, but I'm getting all kind of visuals here. Is going into the brain, is that the only way to stop the hemorrhagic stroke or to stem the damage?
That's a great question. There was a recent trial, and I don't want to bore you too much with this, but we finally found that there's a way to do a very, very, what we call minimally invasive type of brain procedure, where we can find where the bleeding is. If it's close to the skull, if it's not deep into the brain, they can use a technique to try to drain the blood and improve your outcome. Because the key is to stop the bleeding and to cut it out. If it's a really bad bleed, think of, when your mama and your grandmama say you got a hard head, I know mine did all the time. And it's true. Our skull doesn't move, but we got big brains. If you went to FAM or you went to Morehouse or Howard, whatever, Spelman, like my wife and all my female relatives, then you've got a big brain. And so if there's all of a sudden blood there, there's no place for the blood to go. It's just going to press on the brain and cause you to have serious issues. So sometimes surgery is needed to get the blood out, but that's, again, only if the blood's on the outer part of the brain. If it's a deep bleed, we just try to control the blood pressure best we can. And typically the bleeding will stop when that occurs. And then we have to work on how best to make sure that the patient recovers the best they can and make sure that we're handling everything else. We're excited about a new trial that we're looking at where there's a clotting factor, something that we can deliver back to the patient to cause blood flow to stop, or at least to clot itself. And we're very hopeful, we're very excited that that we can show that if we give that sort of treatment, it's called factor 7. If we give that treatment quickly, we can now have something that could help the bleeding strokes, because those are the ones that put us, unfortunately, in the grave or in a nursing home or, you know, that sort of thing.
And when you say quickly, we're talking within. So my aunt had a stroke during COVID, and it was a situation where the issues were compounded by the health systems for poor people. This is in Mississippi, by the way. So you already know. So you go to the doctor, you go, "Hey, doc, I'm feeling like this, this, and this." And she's sitting around in the waiting room for 3-4 hours before they realize, oh, she's having a stroke. And at that point, things had progressed so quickly for the worse for her that it was one of those situations where if they'd have caught it a little sooner, or if the medical professional had been on their thing, or maybe if my aunt herself died, like there was a breakdown in the awareness where we were told as a family, oh, if we'd have caught a couple hours earlier, the mobility would have been this instead of what it ended up being, until she passed years later. And, you know, she ended up with partial paralysis on one side of her body. When you say closing the window, is there a specific window of time from when a stroke? So I know they differ in severity, but is there like a 15-minute or a 30-minute, or like, so when you say closing the gap, what is that gap kind of approximately?
I appreciate that question. There's a lot to it. You know, my heart and my thoughts go out to your aunt in all seriousness, because I hear this all the time. And this was a big push for what I was trying to do with advocacy work with the American Heart, American Stroke Association, and what I've been trying to embark on with our stroke program where I work at Ohio Health. And that is really being overly emphasizing the importance of time when it comes to getting to the emergency room as soon as possible, or calling 911 as soon as possible, and creating an environment in communities where we have the knowledge of EMS providers, we have knowledge of the lay public and community members who might be witnesses to a stroke. We have knowledge of emergency room physicians. We have knowledge of primary care physicians. And of course, we have a robust, dedicated stroke program of stroke neurologists like myself, stroke interventional procedure specialists, neurosurgeons, these sorts of things, to really, because it's a team-based approach, nursing care, everything. It all comes into play. Even down to who reads the pictures, the brain scans, CT scans, and MRIs. So because if we don't understand that it's a multi-layered approach, then there will be gaps. You might have 4 of those things at scale, but then one of them is missed, and then there's a critical delay in diagnosis and delay in treatment. So the key is really, that's why, you know, with American Heart, American Stroke Association, we really push knowing what the signs and symptoms are and what to look for. And then what I tell people all the time, you don't dial my office, you don't kind of hit me up, you know, on a text or a cell phone. You don't Google it. You don't go to ChatGPT about it. You don't call your neighbor. You don't call your cousin and them. You call 911 to make sure that you, and hopefully you are in a community where there are proper protocols. If someone's exhibiting signs and symptoms of stroke, they act fast to get them to the right place.
Right.
Because not every emergency room, not every hospital, not every stroke center is created equal. And the EMS providers typically should know that and know, okay, there's these symptoms going on. They need to go to this place. because they're in tuned on what this is, what this isn't. And at least if they're not sure, they can get the right workup, kind of worked up and kind of figured out in a timely fashion, because minutes matter when it comes to this. There is a clot busting drug that we give through the IV for people that are having the ischemic stroke, where clot occurs, or where blood flow is blocked. And that is very time dependent, Roy, to your point. But it's typically within 3 hours for certain high risk people, like older people that have that are on certain medications, people that are diabetic and elderly. But really, the majority of people, they can get that drug within 4.5 hours of when they were last normal. But the magic of the medication is getting it quickly.
Everything is about time.
Time is brain, because if you get it done if you get that medication within an hour, there's a very high chance you're walking out of the hospital.
Wow.
If
well,
let's 4 minutes, 29, or 4 hours, 29 minutes, then you might have a longer road to hoe.
We are hearing from the expert, Dr. William B.J. Hicks. Let's go to someone who has survived this and she's lived through this. Please welcome Dawn Turnage. Dawn, thank you for joining us today.
Hi, thank you. Thank you for having me. Hello, everyone.
Hey.
Dawn experienced a stroke and survived. And so when I ask, how are you, Dawn, I really mean, how are you?
Yes, I am doing wonderful. Dr. Hicks, I'm right here in Columbus where you are.
Fantastic.
Yes. And in my situation, I'll share my story.
Your story, please.
Yes, I was having the blurred vision, the dizziness, the confusion, but I also had two jobs. I also know that I had to keep going. And I knew that where I was working at, that I had appointments set. So I was living life and knowing that I was also trying to get better with my health. So I was in a program to where I had the competition of a weight loss competition. So all week long, the dropping of things and the excuses that I had is what I was doing. I was like, oh, my vision is blurry, but I better make an eye appointment, And I was ignoring all of the signs, and exhaustion was there. And I said, oh, I better cut back on my hours. But I knew on this particular day that it occurred for me that I had was going to weigh in my competition. I wanted to win, right?
Of course.
So I went to work, and I just felt so dragging. So I went to the bathroom and I chugged down a Pepsi because I couldn't have them see me drink a Pepsi, and I'm about to work out, right? But when I didn't realize that I must have, passed out or something. I woke up and I was like, did I fall asleep? So, got through the workout, and on my way home, I do recall being at a stoplight and cars were blowing. So again, I apparently was having another episode in which I was suffering from a ischemic stroke, a mini stroke. And I got home to my apartment, and I was sitting there. It's like, okay, I'm just gonna lay down for a minute, and then when I get up, I'll, just get my evening started. So while laying there, I received a cell phone call, and it was a FaceTime from my sister. And I wasn't going to answer at first. And then I said, I'm just so tired. I answered the phone, and she says, well, your niece wants to speak to you. She keeps calling out your name. They call me TT. And she was like, just talk to her, this her first child at the time. And she was like, just talk to her, help me out, because I can't stop her from crying. So I said, well, put her on the phone. So I was like, hey, Naomi. And she was 2, but she's very articulate. And she says, TT, you're making faces at me. And so I was
So that's the first of the signs.
That's the first of the signs,
right?
Yes.
FAST, right?
Yes. She said, and she says, and her 2-year-old self, she said, you mean, right? And so she started to cry again, which got the attention then of my sister to come to the phone to see what was going on. And my sister, blessed her, she's a physician assistant, and she saw the signs. And she kept me on the phone and had her husband contact my other sister who was here in Columbus. And they My sister came over and actually was the one who she got there. And I said, "Oh, I'm fine." Again, excuses. I said, "Just take me to an urgent care." It's similar to a doctor where I could hear him saying, "Not every place can treat you." So I said, "Take me to an urgent care." I said, "I don't want to go to no hospital." I said, "I'm not even dressed right." Like, who says that? Well, right? So we go to this urgent care, and my sister is texting the other one and saying she's not listening. We're at this urgent care. I don't think they can help her. So they misdiagnosed me with having Bell's palsy. So at that time, the doctor comes in and says, they was going to treat me for the Bell's palsy and what I need to do. And another person comes in and tells the doctor, we just received a phone call, and it was my sister that's the physician assistant. She called in, and at that point just used her, credentials for the purpose of saving my life. That what she had saw, what she had was not any signs of Bell's palsy. She was actually the signs of the stroke, as she told, So at that point, they rushed me to the hospital, and here I did have a blood clot that had been traveling. And the doctors say that if I would have laid down that or did not answer that phone, that I wouldn't be able to share this story, that I'm sharing today.
Dr.
So
Hicks, that's a story that probably is not unfamiliar to you, but for a lot of us, that really brings it home, doesn't it?
Yeah, Don, thank you so much for sharing that, because I do, as Sybil just alluded to, that will resonate with so many more people. So the more we have survivors sharing their story, the more we can arm folks with understanding that, kind of what to do, not to do. I want to commend your family members that were able to see you and were insistent.
Mhm.
I've heard so many other situations where a family member will take the lead of the person dealing with the stroke, who, and let's be honest, it doesn't hurt.
Mhm.
So strokes don't often hurt. So people like to explain away things that don't hurt. You're clutching your chest, you want to get somewhere very quickly.
Mhm.
If you're in a car accident, you're in a trauma, something happened to your leg, you're having trouble, because of pain, you want to get to a hospital. You want to see a doctor right now. When it comes to stroke-like symptoms, people like to explain it away. So I
Yes.
really appreciate that your family members, they were advocates for you. And you also highlighted, the issue with urgent care. Urgent cares are great for certain things. Urgent cares are, and urgent care specialists will tell you this as well.
Mm-hmm.
We don't handle strokes here. We should not. If they accurately diagnosed you, they would also say, hey, we don't deal with this. So they're just not, they don't have the tools to provide kind of expert level and kind of time dependent care that we do at the stroke centers around Columbus and in and around the United States.
Yes.
But
Doctor, I know that you have to leave us. I know you're a busy
Yes.
man. Can you just explain fast, and then we'll let you go? I just want people to understand because, as I mentioned, FAST.
Yeah, I would say that this is very key. It's something that we really want on the top of everybody's mind when we're thinking of stroke-like symptoms. It's easy to remember, and it's an acronym. So the F stands for face. So as Dawn perfectly alluded to, the fact that family members noticed that her face was different. So if you ask someone to smile and one side is up and the other side is down, that is a stroke-like symptom. The A is for arm. If your arm suddenly drifts, or if it's weaker than the other side, same with the leg, that is a stroke-like symptom. And then S is for speech. If your speech suddenly changes, if you sound drunk and you haven't had a drink all day or all night, if you are having difficulty getting your words out, it seems like it's a struggle just to get the words out like normal. Or if the words that you're saying make no sense, it's like a word salad jumbled up together and people aren't understanding what you're trying to say. Those are critical stroke-like symptoms. And then the T is for time. And like I mentioned before, not time to down my office, not time to, use your phone for other things and to dial other places. You dial 911, and then everything else takes care of itself. It primes the stroke team to get ready for somebody coming into the hospital. It primes the emergency room team to get ready. It primes the CT scanner team to get ready. It primes the EMS medics to be prepared. So it sharpens everyone's hearts and minds on what we could potentially do for somebody with stroke-like symptoms. When we get false alarms time, we just say, oh, never mind, it's not a stroke. But you want to get in that kind of lean into what is possibly going on, because it's time dependent.
If I feel myself in a situation like Dawn, and I think that I'm dealing with a stroke, but the doctor's like, nah, it's Bell's palsy. You just ugly in the face. How can I advocate in the moment, in the triage, for them to go, no, do whatever stroke test you need to do on me real quick as well? Or does it take just going to another place to get a second opinion at
Or
that
having
point?
an advocate there with you.
Yes,
Yeah.
I think
Because my brother can't call. My brother a barber. They ain't gonna listen to no barber calling the hospital.
And this is where health equity comes into play. This is where cultural competency comes into play. My Congresswoman, Representative Joyce Beatty from the 3rd District of Ohio, who's the Congressional Black Caucus lead, just went on the congressional floor and spoke on the need for developing DEI and continuing DEI in medical schools to provide culturally competent positions. A certain side of the aisle is trying to eradicate that, which is ridiculous, because it is this scenario that Roy just talked about. If you ensure that future physicians and current physicians and providers are more culturally competent, then you can start to have a bit more or at least understand there might be some unconscious bias, and there might be some implicit bias that you'll have to work through in order to be a more effective clinician. That is something that we have to make sure continues into perpetuity. We need continued education, medical education, to make sure that we're always checking ourselves. Even though you have a white coat, it's not a Superman cape or a Superwoman cape. So that is something that's critically important. And if you are getting that initial pushback, yes, it is where you got to advocate for yourself. And if Roy, like you said, if your relative's a barber and it's kind of a little quiet on this sort of stuff, well, the doctor knows. No, you need somebody with them to be an advocate and say, okay, well, how do we know that for certain? Have we gotten all the tests done? What about these tests? And this is where asking critical questions to providers are important. It's not being standoffish and just, there's a way to have a communication and a discussion about it. Well, we have a strong family of this in our family. Hey, I know that I might be in my 20s, 30s, 40s, but I've been educated that this happens. We have pre-existing conditions in our family. I have a clotting disorder like a lupus or a sickle cell anemia. These things can happen. So I just want to make sure that we don't miss anything. That sort of kind of follow-up questions, concerns can kind of help prime a provider to say, oh, well, okay, well, we can order something else. It happens all the time, unfortunately. Worst case scenario, you will have to seek that second opinion. And, and unfortunately, that happens every day in this country. And we're working hard on the healthcare side to try to eradicate that.
Dr. Hicks, I'm going to kick you out of this because I know that you have. I'm sorry, Don.
I think I go back to work. I'm having too much fun with y'all.
Could I just share with Dr. Hicks one thing?
Sure.
My niece is in the Made for Medicine program.
Oh, that's beautiful.
Kendall Withers, she just did the white coat ceremony.
Oh, and I was
recent. Yeah, you were there, so I saw you there. I just wanted to make, thank you for being involved and part of that program. She loves it, and I appreciate the opportunity to share that I did see you. Yeah.
Oh, Don, thank you so much. Before Sybil kicks me out, I will say, just for those listening, Made for Medicine, as Don alluded to, it's a initiative, a nonprofit created by my very close friend, Spellman's sister, Dr. Laura S.V. Bell, who is an emergency room physician here in Columbus, and she has partnered with other Black physicians like myself and others to identify students who are 6th, 7th, 8th grade and beyond who have any interest in becoming a physician. And so really taking a grassroots approach to letting them know about what doctors do, what type of doctors there are. There are doctors that look like you, and we want to, in a role like mine, I want to hire you. Once you become a stroke neurologist, once you become a neurosurgeon, once you become a psychiatrist, but priming them early on to say you can do this, and let's show you how. And so thank you for those words.
Bravo.
I appreciate my time with each and every one of y'all, and bless y'all.
And we're going to get that laugh for you from Roy. So when Roy comes to Columbus, we're going to get you hooked up. Okay.
Oh, yeah.
I'll be out there in Eastern sooner or later. I know about Columbus.
All right. Big fan over here, for real.
Much respect.
Thanks so much, Dr. Hicks. We appreciate your time.
I appreciate all of y'all.
You be well. Thank you.
Thank you.
So, Dawn, I'm glad you got a chance to mention that. And now you have a rising physician in your family. That's great.
Yes.
Let's go back to your story where they determined what your situation was with the ischemic strokes. And can you do you have an idea, or did they tell you like the period of time between when your sister got to you and you went to urgent care and then got to a full functioning hospital?
Right. So that is definitely another doctor had mentioned that medicine, you only have that certain window in order for the ischemic stroke. And so that is definitely what happened with me. I was able to get to the hospital right quickly. So in my case, it was from the time that I was normal again, because with the TIA, I was going in and out. So the time I was normal again, I was at the hospital with the medication within a 30-minute time. So the fast definitely is something that my sister, when it started with the FaceTiming, it was a quick reaction. If we could possibly had even called the 911 and took me from my apartment to the hospital, it probably even have been even faster, or even, but I was still in that window and blessed to do so. So. Yes.
So the role of family and those around you played a big part.
It played a big part. And the role, because you know how I'm not a big FaceTime type person, but to sit there and answer the cell phone at that moment. Living in the house, in the residence by myself, I was like, I'll call her back. She don't want nothing. You know how we do. Let me just take a nap. So, but I will say that was the angel.
The insistence of your niece.
Yes, definitely angel. And to this day, she goes around and she talks to her friends, and they let her do programs here with the Heart Association.
Oh, that's awesome.
And I take her with me. And there's videos out, of us, talking about this, because one thing for sure, we have to be our own advocate.
Right.
And doing that advocacy, I have learned a lot about even our family history. I never even knew that my grandmother had a massive stroke, So that's one thing that, as part of me talking, especially in our Black and Brown communities,
We have to talk.
have to know. We have to talk. What we do, we're used to, grandma or auntie or grandma died. It'll be okay. And it's an adult thing. No, we have to have those crucial conversations to lead us up into knowing what our family history is. Because it's already a challenge for those who don't, or who are either adopted or not with their biological family. So to have the opportunity to know what your family history is and the genetics makeup, and the lifestyle, that's your environment that you're living in, it played a crucial part in some of the changes that I had to take place in my life.
So check this out. We normally talk about using the holidays as an opportunity for us to talk to our families, Thanksgiving and Christmas and what have you. But we have these summer holidays coming up. We just had Mother's Day, and we'll have the 4th of July. And to have these conversations, like, I'm putting together not a family Bible, but a family guide, and talk about these things, because I've had this, and we'd like to give people, other family members, an idea of what has happened in the past and where we go from here, right, Roy? Like with your aunt. And so this is a good time for someone like you, Dawn, to share with people the importance of
Mhm.
having these conversations. You don't want them. You don't want to talk about wills. You don't want to talk
Right.
about dying. You don't want to talk about, but we have to have these conversations.
Yes, we do. And we have to have them early and starting with our include the children.
Yeah.
Definitely include them, So because there won't always be an individual who has a family member, like Roy said, that can call the hospital,
Right. Right.
So and especially in our communities that are underserved. So we have to be connected to what our family history is. And I'm going to take that idea too and use that. Thank you for that.
It's
Yeah.
yours. It's
All right.
yours.
Thank you.
Yeah.
So Don, tell us how this has affected your life.
Mhm,
How physically,
mhm.
when you came out, was there a certain amount of rehab that you had to
Mhm.
go through, and how did this affect your spirit?
Yeah, well, physically, I was like I was in a hospital for about a week, and my speech was slurred, and I just had to. I went through probably possibly not as much um, therapy as I had to go to. Sometimes my memory sometimes is a little bit off, and I
Hmm.
know that what I had to do was learn that no is a full sentence, and tell people,
Mhm.
because stress can happen. Stress can actually play a factor in that. And so I had to make sure that was up on my doctor's appointment for about 2 years. I did go, and I did choose to electively lose weight. I had lost close to 150 pounds,
Wow,
and
that's
and
awesome.
it's not easy.
No, it's
It's
not.
not definitely not easy. So so I'm more aware. I'm more
And you
aware
did that
now.
without divorce. That's big.
Yes. Well, yes, you're right. You're definitely right. But I will say, because you brought up a good point, that was part of my divorce had been final about 4 years, but it still was a baggage.
Uh-huh.
So, and then that was the reason why I was working the two jobs because of all of that other things that was going on. So I was just trying to do life again. So,
Yeah.
but in doing life again, I was ignoring what my life that I needed my life in order to proceed. So I didn't go through a lot of the physical therapy, thank goodness. I left the hospital and went back to work within 3 weeks. And then just made some life changes when it came to my eating habits, my blood pressure medication.
I was
I
going to ask you,
did,
did you have
yes.
high blood pressure?
I did have high blood pressure, but the dosage did have to change
Okay.
for that. And then it's hard not to eat the fried chicken and so so I had to do all of that in the moderation. Okay, so and then
Do
getting the
we have to
buddy
send
system.
Papa Roy to your house
Right,
like he does with his
exactly.
8-year-old?
Yes.
I think
Yeah.
I think part of it also, Sybil, is in having these tough conversations that they not come from a condescending place.
Right.
Hmm.
And this is just speaking as a person who has tried to talk with his mother. My father passed when I was 16, and
Mhm.
it wasn't necessarily, it was prostate cancer, but the conversations I've attempted to have with my mother and some of my older half siblings about our lineage and our past, I made the mistake early on of being very preachy. You need to tell me this because
Hmm.
Right.
not
Hmm.
realizing that even in talking about health and wills and life planning and
Hmm.
what color you want your casket to be and all that stuff, you
Hmm.
are forcing people older than you to do something they may have not yet ever done, which is face their own mortality
Mortality. Yeah.
Hmm.
Right.
and
Hmm.
giving them. And the conversation shifted for me with all of these older people in my family when it was about you can empower us, me, my son. Now we know what to look for, what to check for, blah, blah, blah,
Mhm.
blah, blah. So I think it's like the way vegans come around at Thanksgiving. Y'all gonna eat
Oh,
that?
right.
And well, you know what? I'm gonna eat the rib and I'm gonna die then. Give it to me. Give me the rib.
Right.
Versus, hey, here's how you moderate that. Put this with that.
Right.
Just think
Mhm.
about
Yes.
other like the silly choice of ground turkey instead of ground beef
Hmm.
because the red meat going blah 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 blah.
Right.
So I think how we enter and initiate these conversations is very key as well because comedian Baron Vaughn says something to me that was very profound. He said that our generation of Black people we're the curse breakers.
Mm,
We're the first ones that are aware of what is happening to us as a race.
right.
We may not have all the tools, but we know what's going on. So we're
Mm-hmm.
trying to figure out how to reverse the trajectory of our people. And we need the old heads to be on board. But
Yes.
they over 70, they stuck in their ways, and it's
Mm-hmm.
hard.
It
Right.
is hard. It is. You're
Yes.
absolutely right. But the curse
Yes.
breakers, that's powerful.
Yeah. And then being fierce with your voice. When you go to the doctors, ask those questions. We're used to you dress up to go to the doctor, you don't sit you whatever they say, they're professionals, you don't say anything. However, no, ask those questions. Be fierce with your voice, be bold in your personality because
Good
it's
for
your
you.
health, you know? And
Yeah.
so those were some of the things too that played that crucial conversations that I had to have.
That's powerful, Don, and that's great
Mm-hmm.
advice as you're going through your
Yeah.
rehabilitation and
Mm-hmm.
having these doctor's visits and conversations. What other advice would you give to people as a survivor?
To just make sure that
Give
listen
up
to
the
your
pork, give
body.
up the
Give up the
ribs.
pork, right? Or if you can't give it up because it's not easy, in moderation, because then your taste buds is going to change anyway, and that's what
Right.
happened, with me. But in moderation, get a buddy says, hey, both of you, make your doctor's appointment together if you can, or at least the accountability piece. Hey, did you go? Did you go? What your doctor say?
Mhm.
So that way, those when you have to have them with other people, it becomes easy. So yeah, now when they see me coming, they be like, if I got on a red jacket because I am an AKA, they be like, oh, it must be a heart association thing. So I was like, no, it's a life thing,
Come
So
on.
and just keep talking about it and making sure that you do your just like you do your other routine appointments. Um, do have your appointments. And one other thing, be an advocate for your community
Yeah.
because our communities do not have, you talked about it earlier, the accessibility and the social determinants that is real in health and in food. So advocacy is definitely important, whether it be writing a letter to your congressperson or your local individual elected officials. Be that advocate for your community when you can while advocating for yourself because you live in that community.
Yes.
One other thing I wanted to mention, Roy and Dawn, and we're talking about time and the importance of time getting a patient to the right people.
Hmm.
Roy, that one of the great comedians of our time is Sinbad, and he suffered a very extensive stroke, right?
Yeah, I
And
just saw him a couple weeks ago in Netflix where they did a benefit
right, yeah.
show for him.
So almost at the same time, in that same period, it was during the pandemic, Tom Joyner had a stroke as well.
Hmm.
The
Yes.
difference was time.
Hmm.
Tom was working out at the time. He's a boxer, and so he was in his boxing ring at home. And the woman who is his rehab coach um, saw the stroke as it was happening.
Hmm.
She immediately knew what she was looking at and got him in the car and to the hospital. With
Hmm.
Sinbad, when they recognized what the situation was, they called the ambulance, and because of the whatever pandemic conditions were going on in Los Angeles, they could not get to him,
Hmm.
and time was just flying by. And
Yes.
so they were
Mhm.
not able to save him in the same way that Tom was saved. He was very
Hmm.
lucky,
Yeah. In
obviously, and
terms of comparisons of mobility post stroke,
exactly,
yeah,
Yes.
exactly.
yeah,
And
Yes.
you look at Sinbad, and he is not the same man that he was, but you know that he has the force of will to come
Hmm.
back and to continue his career. Tom has the all of the gifts of time that time have given him in order to make this. And it's not easy
Hmm.
at their age either to make that complete turnaround as a young woman like Dawn is able to do.
Hmm.
But just think
Hmm.
about that,
Yes, true.
and time is so very important in all of this.
Yes,
yes,
That's really
yes,
definitely.
indeed.
Yes,
Dawn,
indeed.
I thank you so much for your time here
Oh, yeah.
today, and I wish complete blessings on the remainder of your days, and good
Thank
luck
you.
to you, your family, and your young niece, your rising position there.
Oh,
Uh,
thank you.
Yeah, absolutely. We want to thank Dr. William B.J. Hicks and also Roy Wood Jr. I want to know where you going, what you doing, where can we promote?
Oh, I'm wrapping up my Happy to Be Here tour. 3 cities left in June: Bloomington, St. Louis, Chicago. That's it. RoyWoodJr.com for ticket information. Then I'm taking the summer off.
Oh, good, good. You're gonna
Ain't
run
gonna be
around
no,
after
ain't
that
gonna be no
8-year-old.
performing. Yeah, yeah, indeed.
Roy, will you come back again? I really enjoyed this.
Absolutely. Thank you for having me.
Thank you so much, my
Thank
friend.
you.
Thank you, Don. I appreciate it.
Thank you. Thank you. Nice
Yeah.
meeting you, Roy. Thank
You
you.
too.
Bye-bye.
Want to remind people that if you want more information on this, please go to AmericanHeart.org heart.org or stroke.org for more information. And all the good people at the American Heart Association, want to thank them: Brittany Glover, Tracy Bertot, Angela Collins, Katrina McGee, and dear Arika Kaysen. And with our company, Yossi Media, I want to thank Cherie White, Diana Chickadilly, Olivia Perez, Yolanda Starks White. Thank you for joining us for Check In and Check Up, and be well.